I'm Dr. Tracy Wayman. I've been in practice for 37 years. I've always done oral cancer screenings. It's just been part of my practice. The oral HPV testing that Fidalab has it just seemed very logical for me to adopt. We actually are kind of surprised at how often we are picking it up.
My name is Mark. My first test was positive for HPV-16, but it was mildly positive. So I don't think at that particular time anyone was particularly concerned because it was a low value. Because I was skeptical, I just wanted to take any possible bias out of it, and this time it came back highly positive. So I think everybody was concerned at that point. My dentist, Tracy Wayman, suggested that I see an ENT right away. They had to use a tube to look at my throat, and almost immediately they saw something suspicious on my right palatine tonsil. So after the biopsy, it came back positive for HPV-16. The next step was to schedule surgery to have it removed, have the cancerous tissue removed from a cancer surgeon. Everything felt normal. I didn't have any of the common cancer symptoms. And you know, my throat wasn't sore and I could swallow normally, so there was no problem. The abnormal tissue was quite small at that point. So Fidalab caught my cancer at a very early stage, and my cancer doctor noted that if I hadn't found that cancer and had let it go, my life expectancy would be about 5 years.
The ear, nose, and throat specialist, Namu Kim, he sent a letter to me thanking me essentially and complimenting our office. I didn't feel like it was really warranted, but you know, he was grateful that we were aware enough to be doing this test because this was the first patient that he had ever received that came through this channel of detecting the HPV and then feeding it through the medical system. Well, as far as testing, you know, it's really very, very easy. You know, the patients that that you're not detecting anything on, well, they don't see as much value. But boy, when you get those hits, you know, a positive test and can start working with those people to prevent this very bad cancer. I mean, it's #1 cancer of the throat these days. Boy, are they grateful. And you know, when you look at the overall cancer rates in the mouth, I'm quite surprised. I have never had any other cancer detected in my 37 years, except in the last few years by using this HPV test. He's got one of the cards. I recently retired, and he has this. I have the card still. It's one of the very few I kept, which is, "Thanks for saving my life."
Definitely do the easy, reliable Fidalab oral rinse test. It's a simple thing to do. It can save your life, just like it did for me.